This video we see about inborn errors of lipid metabolism. Part 1 we see about the culture disease and inborn web disease. In this video we see about Tay-sach disease and Fabry disease. Once again, just we have repeat what is inborn errors. Inborn errors of metabolism are a group of metabolic diseases which can be formed as a result of the lack of single enzyme in a single metabolic pathway. These disorders are hereditary and tend to occur only in closely related family groups. Already we see in the first part that is 6 diseases in lipid metabolism. Culture disease, Inborn-Wick disease, Tay-sach disease, Fabry disease, Revsum disease, Crab disease. First part we see the details about cultures and Inborn-Wick disease. In part 2 we see about Tay-sach disease and Fabry disease. Okay, first we see about Tay-sach disease. This disease occurs due to the divisions of the enzyme ganglioside. So due to the divisions of this enzyme, that is accumulation of gangliosides in brain and spleen. Tay-sach disease is a rare genetic disorder passed from parents to child. It caused by the absence of the enzyme ganglioside that helps breakdown of fatty acid substances. These fatty acid substances called gangliosides built up to toxic levels in the brain and spinal cord and affect the function of the nerve cells. So due to the accumulation of these gangliosides, due to the divisions of the enzyme ganglioside, so accumulation of gangliosides lead to the toxic levels in brain, spinal cord, so may lead to the nerve cells affected. In the most common severe form of Tay-sach disease, signs and symptoms start to show up to at about 3 to 6 months of age. That is, Tay-sach disease may develop at the 3 to 6 months of the age. As the disease progresses, development slows and muscles begin to weaken. Over time, this leads to seizures, vision, and hearing loss, paralysis, and other major diseases. Children with this form of Tay-sach disease typically live only for a few years. So there are different type of Tay-sach disease. One of that is the children may be live before they may die before the 1 year. Less commonly, some children come. This is referred as the infantile type of Tay-sach disease. This is the juvenile form of Tay-sach disease. They may live to either into the teen years. Until teenage they have to survive. Rarely, some adults have late onset form of Tay-sach disease, which is often less severe than forms that being in childhood. There are 3 types of Tay-sach disease. One is infantile, juvenile, another one is adult. Sorry, it is a late onset form. So, symptoms also classified based on this 3 types of Tay-sach disease. So, first one is about infantile form. Already we told that this infantile form, children can survive up to 3 to 6 months age. Usually few years. Symptoms develop at 3 to 6 months. The survival is few years. Symptoms are exaggerated startle response when the baby hears loud noises. That is delay response. Cherry red spots in the eyes. Loss of motor skills, including turning over, crawling, and sitting up. The child cannot be able to turn when you have to call them, or they are not able to travel or sit up. They cannot be able to sit at that age. Muscle weakness progressing to paralysis. Movement problems, seizures, vision loss, and blindness, hearing loss, deafness, problems swallowing, that is they can't be able to eat anything or swallow it. Loss of mental functions and lack of response to the surroundings. Growth in head size, progressive macrocephaly, that is the enlargement of head. Juvenile form, this is less common. The signs and symptoms will be varying severity and begin in childhood. Survival is typically into teen years. The symptoms are behavior problems, gradual loss of skills and movement control, frequent respiratory infections, slow loss of vision and speech, decline in mental function and responsiveness, and seizures. In late onset or adult form, this is a rare and less severe form with signs and symptoms. beginning in the late childhood to adulthood. Severity of symptoms varies greatly, and this form does not always impact life expectancy. The symptoms are muscle weakness, clumsiness, loss of coordination, tremor, muscle means that is nadakan சொல்லுவாங்க. Muscle spasms, loss of ability to walk, problem speaking and swallowing, psychiatric disorders, sometimes loss of mental function. So these are the symptoms of Tay-sach disease. Let's see about diagnosis. So there is a nerve problem and in a eye complications. So you have to check the nervous system and eye examination. Diagnostic blood test. Blood test check the levels of the enzyme in the blood. They may be low or absent. And then genetic testing is examining the gene to identify whether the changes that indicate Tay-sach disease. So during an eye exam, the health that is doctor may check the red spot in the black of the eyes. It's a sign of disease. Next, prenatal testing. This can be done during pregnancy by removing a tiny piece of placenta, chronic villi sampling, or by removing a small sample of amniotic fluid around the baby to find out the enzyme may be present or absent. Next, treatment for Tay-sach disease. There is no cure for the Tay-sach disease, and no treatments are currently proved to slow progression of the disease. Some treatments can help in managing symptoms and preventing complications. So we cannot be able to cure the disease, but we got to use some support to manage the symptoms, the pain during the symptoms will be we have to decrease and prevent complication. The goal of the treatment is support and comfort. The supportive treatments are medications. A large number of prescription medications are available to reduce symptoms and prevent complications. For example, anti-seizure medications or antibiotics for the infection. Respiratory care. Accumulated mucus in the lungs is common and results in the high risk of lung infections that cause breathing problems. Chest physiotherapy, exercise, and other techniques can help remove mucus from the lungs. Medications to reduce saliva production and positioning techniques are also options to reduce the risk of mucus accumulation and prevent aspiration pneumonia. So most of the lungs problem will be common in this disease. So we go to remove mucus by medications, or then we have to take a drugs or the pushing techniques that how to sleep. It will reduce the mucus accumulation in the lungs. In this, you have to prevent the breathing pneumonia. Next, nutrition and hydration. Child may have trouble of swallowing or develop respiratory problems by inhaling food or liquid into the lungs while eating. So to prevent those problems, doctor may recommend an assistive feeding device such as feeding tube. So in order to take food, they can't be able to swallow it. So the doctor suggested to give a feeding device, feeding tube. So through the tube, we can be able to give the food. Feeding tube may be inserted through the child nose until into the stomach, or surgeon may surgically insert a feeding tube directly into the stomach. So this is called as gastrostomy tube. So on the child cannot be able to swallow. So the doctor suggested to insert a feeding tube through nose or directly inserted into the stomach. Next is the physical therapy. As the disease progresses, child may benefit from physical therapy to help keep joints flexible and maintain as much ability to move as possible. So they already the symptom is they cannot able to flexible their joints. So giving a physical exercise, they may be move their hands and flexible in the joints. The delayed joint stiffness or reduce or delay of loss of function and pain that can result from affected muscles can be cured by the can be reduced by the physical therapy. Next, occupational therapy. These therapeutics can recommended activities and support devices to help with daily functioning. So they have to give some daily function actions. Speech and language therapy. Speech and language therapists can assist with swallowing problems and give some speech to the improve their speech. Potential future treatments. Research and treatments such as gene therapy, stem cell transplantation, or enzyme replacement therapy may eventually lead to cure or treatment to slow progression of the Tay-sach disease. This is common to all the inborn errors. Treatment is gene therapy, stem cell transplantation, or enzyme replacement therapy may lead to cure or it may slow the progression of any inborn errors. Okay, that's all about the Tay-sach disease. Next we see about Fabry disease. This main causes is people who have Fabry disease do not have the enzymes that break down lipids or fats. These fats cut in the blood vessels and tissues, raising the risk of heart attack, stroke, and kidney failure. This genetic condition is passed from the parent to the child, that is hereditary. So the enzyme deficiency is ceramide trihexosidase. So due to this enzyme deficiency, there is a large amounts of ceramide trihexoside accumulated in the kidney and other organs. So clinical findings are the mild and might not appear until later in life. Males tend to have a more severe symptoms than females. Fabry disease symptoms include skin rash, kidney failure. Male patients generally die due to progressive renal failure in the fourth or fifth decade of life. So already they so mostly compared with male and female, males are mostly affected by the Fabry disease. Cardiac enlargement, edema of the extremities, so all joints that we have edema means bulge weaken. Some patients suffer from excessive pain in the joints, corneal opacity, that is there is some enlargement in the cornea, and vascular dilation are frequent, numbness, tingling, burning or pain in the hands or feet, extreme pain during physical activity, heat or cold intolerance, abnormal obesity of the eye, that is corneal obesity, which does not change someone's vision, dizziness, flu-like symptoms including fatigue, fever, and body aches, aching pain. Gastrointestinal problems such as diarrhea, constipation, abdominal pain, carrying, hearing loss, ringing in ears, that is ear, they have to loss of hearing, then ringing in the ears, and that condition is tinnitus, high levels of protein in urea, that is your protein is excreted in the urine, red, red or purple skin lesions, angiokeratoma, that name the condition, the skin having purple skin, purple lesions or red lesions on your chest, back, and in genital area. That condition is called angiokeratoma. Sweating less, that condition is called kyphoscoliosis or not at all. There is no sweat is present, condition is called anhydrous. Swelling in the leg, ankles, and feet, that is edema. So these are the clinical symptoms occurs in the Fabry disease. So diagnosis, enzymacy, genetic testing, and perinatal testing. Complications, heart problems including arrhythmia, that is English heartbeat, heart attack, enlarged heart, and heart failure, kidney failure, nerve damage, peripheral neuropathy, strokes including transition ischemic attacks. So these are the complications occurs in the Fabry disease. Treatment, there is no cure for the Fabry disease. Enzyme replacement therapy, stem cell transplantation, another one already since is gene therapy. These are maybe the treatment, maybe it's a cure or it may be lead to suppress the progression of disease. Okay. That's all about the Fabry disease. These are the reference I will prepare for the slides. Thank you. Next we see a bit the part third and next two diseases, the Refsum disease and Kraft disease. Once again, thank you.